So many of you have been asking me about hormones post-menopause, and so here it is. And today I'm in my wife's office, which is so much cooler than mine because look at this background. But anyway, let's talk about post-menopausal hormones. The very first thing you have to realize is before we talk about the sex hormones, before we talk about progesterone and estrogen and testosterone, the sex hormones, we have to balance the other hormones in the body. You have to make sure that your insulin is on point. Yes, insulin is a hormone. You have to make sure you're not insulin resistant and that your blood sugar levels are normal because that affects your hormones. You have to make sure your adrenals are on point and that you don't have adrenal fatigue because that affects your hormones also. And of course, you have to make sure that your thyroid is really on point. Really on point doesn't mean a normal TSH only, right? Make sure you check T3, T4, and your antibodies. All of those hormones really affect your sex hormones as well as your overall well-being. So you have to address those first. And I did a whole talk about it. It's on my YouTube and my podcast. So now that we covered those hormones, let's talk about the sex hormones, progesterone, estrogen, and testosterone. And I am a huge fan of BHRT, bioidentical hormone replacement therapy, which is very different than just HRT, which is hormone replacement therapy often given classically in a GYN office. HRT and BHRT are not the same. HRT tends to be very, very high dose, tends to be mostly estrogen without much consideration for progesterone and testosterone, whereas BHRT is about low dose, balancing, customizing the hormones of E2, E3, progesterone, and testosterone based on your needs and getting you to your normal physiological levels. And BHRT is not just about symptoms. It's not just about hot flashes or vaginal dryness. It's actually about protecting your heart, protecting your bone, protecting your brains, protecting your whole cardiovascular system. So it has so many more benefits than just managing your symptoms, although that's important too. When you're doing your own research and reading articles, make sure you notice that the articles that might have adverse effects, they're probably talking about classic HRT with high dose estrogen and probably not talking about BHRT. So make sure that you notice which hormone therapy they're talking about in any article that you're reading. So just to recap, and my patients will tell you this, we always fix everything else first, the thyroid, the adrenals, the insulin, and then we talk about sex hormones. And when we do that, we do BHRT, we customize it based on test results, and we use all of it to optimize health. So whether you want to work with us or another functional medicine provider, make sure that you're asking for BHRT. I hope this helps. I'll talk to you guys soon.